Indirect commentary in mental health. Understanding language, discovering patterns, and coping with triggers, in line with anger management. Written, edited, created, and published by Nisa Pasha, executive political health guru, peer counselor, and educator. mentalhealthrevival.org. When you live in a world that sometimes feels chaotic, overwhelming, or unsafe, the words you hear and the words you use carry more power than you may realize. For peer mental health consumers, disabled adults, and young adults navigating crises, understanding indirect jargon and indirect commentary isn't just about academic knowledge. It's a tool for anger management, emotional regulation, and coping with aggressive or passive-aggressive behaviors in your environment. This article explores how these communication patterns appear, why they happen, and how recognizing them can help you detach safely, protect your mental space, and reclaim your power even when others are acting in ways that trigger anxiety, frustration, or anger. What are indirect jargon and indirect commentary? Language is how we give shape to experience. It's how your nervous system, emotions, and cognition make meaning out of daily life. But sometimes, either because of trauma, psychiatric symptoms, or the behaviors of people around us, communication can become indirect, coded, or metaphorical, and you may find yourself needing to read between the lines. Indirect jargon, a definition. Indirect jargon is when speech or expression uses idiosyncratic words or symbols meaningful only to the speaker, feels symbolic, metaphorical, or mystical, rather than straightforward, appears unclear or confusing to others, can emerge from cognitive or emotional overload, trauma adaptation, or psychiatric symptoms. Examples you might notice: the walls are talking tonight. Instead of "I feel unsafe," the mailbox holds the secret, rather than clearly expressing worry about being monitored. The clock knows my schedule, instead of describing anxiety or hyperawareness. These forms of language are not inherently wrong or dangerous. They often reflect internal processing, creativity, and survival strategies in complex environments. Indirect commentary, a definition. Indirect commentary is when someone hints at an idea instead of saying it outright. This may be speaking around a topic rather than stating it clearly, using metaphors, coded speech, or implications, offering suggestions without committing to explicit claims. Examples you might hear in daily interactions: some people might be listening, instead of "I know someone is watching me." It's obvious what they want if you pay attention, rather than directly accusing someone. Recognizing indirect commentary helps you interpret messages from others without taking them personally, a critical skill when navigating passive-aggressive behaviors. Why this matters for anger management. When someone communicates indirectly, especially in passive-aggressive ways, it can trigger anger, frustration, anxiety, and defensiveness. Understanding why these patterns appear allows you to break the cycle of reactivity. Indirect language from others does not automatically equal threat. Often it reflects fear, avoidance, or insecurity, difficulty expressing emotions directly, past experiences with trauma, control, or judgment. Recognizing this helps you detach emotionally, preventing reactive anger and allowing you to choose your response rather than react impulsively. How language and meaning processing relate to mental health. Communication is a mirror of internal processing. In mental health contexts, your own indirect language, like jargon or commentary, can reflect stress, psychosis, or mood disturbance. Similarly, the indirect or passive-aggressive speech of others can influence your mental state if you don't recognize it as separate from your own reality. Normal versus disordered or triggering communication. Normal communication is predictable and coherent, contextually interpretable, shared in meaning between speaker and listener. Disordered or indirect communication may include loosely connected ideas, ambiguous messages or symbolic content, metaphors that obscure intent, triggering content that escalates stress or anger. Why people use indirect language. People use indirect speech for many reasons: to express something difficult or dangerous to state directly, to protect themselves from judgment or aggression, because thoughts and emotions are too complex for literal speech, due to psychiatric or cognitive processes, such as during mania, psychosis, or high emotional arousal. Recognizing indirect language in aggressive and passive-aggressive people. Passive-aggressive behavior often mimics indirect commentary. You may notice hints, sarcasm, or underhanded remarks, instead of direct statements. Blame implied through metaphor or indirect phrasing. Avoidance of responsibility, leaving you to interpret meaning. Subtle criticism that triggers anger, anxiety, or defensiveness. Example scenarios. Coworker says, "Well, some of us actually care about deadlines," hinting at criticism without direct confrontation. Roommate comments, "Interesting choice of music," during a situation you find upsetting. Peer in a support group murmurs, "Not everyone sees things the way you do," implying judgment. By identifying patterns of indirect speech, you gain insight into behavioral triggers and can choose detachment instead of reacting with anger. Medical and theoretical insights. In psychiatric contexts, indirect speech may be influenced by psychosis, loosened associations, symbolic meaning, disorganized thought; mania, rapid associative speech with metaphorical leaps; trauma, hypervigilance, coded language for self-protection; personality differences, avoidant or passive-aggressive tendencies; theoretical impacts on anger and anxiety. Misinterpreting indirect commentary as direct attack escalates stress responses. Failure to detach emotionally can amplify anger or anxiety. Recognizing indirect speech as behavioral strategy rather than personal threat allows for better emotional regulation. Coping and regulation. Step 1. Recognize indirect patterns. Tips to identify indirect jargon or commentary. Notice repeated metaphors or symbolic phrases. Observe patterns in tone, timing, and delivery. Track how these patterns affect your emotional state. Ask yourself, is this about me, or is this a reflection of the speaker's own processing? Step 2. Detach and protect your emotional space. Pause before reacting. Take a breath, step back, and assess. Label your own feelings, anxiety, anger, or frustration. Recognizing these prevents projection. Avoid assuming intent. Indirect speech often says more about the speaker than you. Use grounding techniques, deep breathing, mindfulness, or physical movement to regulate emotional arousal. Step 3. Respond strategically. You can acknowledge, clarify, or set boundaries without engaging in reactive conflict. Ask clarifying questions. Can you explain what you mean? Restate what you heard. I think you're saying X, is that correct? Set limits. I'd like to continue this conversation when it's direct and respectful. Practice emotional neutrality. Remain calm, measured, and assertive. Step 4. Reflect on causes and impacts. Indirect speech or passive aggression happens. Fear of confrontation or consequences, learned patterns from toxic or controlling environments, psychiatric or neurodiverse processing differences, emotional dysregulation in peers or caregivers. Impacts on you if unmanaged. Increased anger, anxiety, or emotional fatigue. Difficulty maintaining relationships or safety. Escalation of mental health symptoms. Brain fog or confusion that amplifies stress responses. Peer perspectives. Real-life examples. Case 1. Jordan. Regularly encountered passive-aggressive comments from colleagues. Reacted with anger, escalating conflict and stress. Identify indirect patterns and detach. Jordan began responding with curiosity, asking clarifying questions, and setting boundaries. Result: reduced anxiety, fewer arguments, and improved mental clarity. Case 2. Alex experienced a peer in the support system using metaphorical indirect commentary to communicate criticism. Initially internalize the messages as personal attacks. Learn to interpret indirect speech without personalizing, and to focus on safe self-expression. Result: more confidence in peer interactions, less emotional reactivity, and improved self-advocacy. Lesson: understanding indirect communication transforms potential triggers into tools for emotional mastery. For peer consumers, track triggers, note situations that provoke anger or anxiety. Identify indirect speech, Distinguish metaphor, coded language, and indirect commentary. Practice detachment. Emotional separation from others' behavior reduces reactive anger. Set clear boundaries. Let others know what communication style is acceptable. Engage in reflective coping. Journaling, peer discussion, or therapy to process experiences. Model direct, calm communication. Showing others how to interact respectfully reduces indirectness over time. Your emotional regulation is your superpower. Recognizing indirect jargon and commentary, both in yourself and in others, helps you navigate aggression, passive aggressiveness, and psychosis-related communication with clarity and dignity. Detaching doesn't mean ignoring. It means protecting your mental space. Boundaries are acts of self-respect. Awareness of indirect language transforms confusion into insight. Peer support, self-reflection, and assertive strategies help maintain calm, manage anger, and reduce anxiety. You are not alone in facing indirect, confusing, or aggressive communication. By understanding, detaching, and responding thoughtfully, you reclaim control over your mental health, your reactions, and your environment. If you have specific questions or concerns, feel free to share. Hope you found this insightful while grasping the key components. Please contact me if you would like to chat in a peer counseling session revolving around this post or another topic. Mental Health Revival, seeking to inspire a unique perception of mental health awareness and harm reduction.